Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about neglected tropical diseases, and joining me on the program is Dr. Anastasia Sampson, the focal point for neglected infectious diseases attached to the Vector Control Services. Welcome to the program, Dr. Sampson.
Thank you for having me, Ms. Martin.
So first off, I want us to talk a little bit about how the vector control functions on a day-to-day basis, and then we'll go into the neglected tropical disease day that is coming up.
Okay, very well. So the Vector Control Services, we have a few sub-departments. So you have the malaria department, you have your Aedes-borne disease department, you have your entomology department, and lastly, you have the neglected tropical disease department. On a daily basis, persons can access services for malaria, whether it be diagnosis, treatment, right at the Vector Control Services. As you know, it's located in the compound of GPHC using the Middle Street entrance. Also for Aedes-borne diseases, they can also access diagnosis, treatment, and many other resources right at our facilities there. And also NTDs are no exception. You have services also available for persons that suffer or, are affected by neglected tropical disease.
Thank you, Dr. Sampson. I know that World Neglected Tropical Disease Day is coming up, and that's on January 30th. For persons who don't know about this day and what it signifies, could you tell us about that?
So definitely. So neglected tropical diseases are those diseases, as the name says, neglected. They're usually forgotten. They're usually pushed to the side when their budgetary allocations at the global level, funds are not really allocated to these diseases. And these diseases, unfortunately, affect billions of persons around the world. And in Guyana, that is no exception. We do have a small population, but also we do have persons that are infected by NTDs. So this day, World NTD Day, it will be celebrated this year under the theme, Unite, Act, Eliminate. And what a wonderful and befitting theme this year, because it goes to show that in eliminating neglected tropical diseases, it's not just a one-person thing that has to be done. It has to be everybody playing their significant and active role in helping to eliminate neglected infectious diseases. All your stakeholders, world leaders, everybody has to play that key part in eliminating neglected tropical diseases.
Definitely a collaborative effort is needed. What is the situation here in Guyana with regards to these neglected infectious diseases?
Okay. So when you hear neglected infectious diseases, or also known as neglected tropical diseases, here in Guyana we have 5 of them, namely leprosy. However, leprosy has its own program and its own director that deals with that. Under my portfolio, I deal with the leishmaniasis, lymphatic filariasis. We also have Chagas and soil-transmitted helminths under neglected infectious diseases. Now, with respect to the last 4 that I mentioned, we do have active programs for 2 of them, namely lymphatic filariasis and leishmaniasis. Now, with respect to lymphatic filariasis, Guyana would have made significant stride towards the elimination of this. As you would also know, there's a global program actually to eliminate lymphatic filariasis as a public health issue. Guyana being one of those countries that is a part of the World Health Organization. So back in 2000, when this program was launched, it has 2 strategies. One, your MDA, also known as your Mass Drug Administration, and this targets all your at-risk population of persons at risk for lymphatic filariasis. Added to that, there's a second strategy called the MMDP aspect, which is your morbidity management and disability prevention. And this targets specifically those persons who are already infected or has the signs of the disease. Okay. So after that program was launched in 2000 with those 2 pillars that I just mentioned, in 2001, Guyana embarked on a school-based survey to find out exactly where they need to take MDA, which community, which region, which population actually needs MDA intervention. that was a school-based survey, and of course, of the 10 administrative regions that it was, all 10 administrative regions it was done in, we had 9 regions that were actually endemic, meaning that these are the regions that we actually identified and found children testing positive for filaria. So we know once there were children testing positive in that area, we had adults that actually are actively infected and that are passing it on. So after that survey was done, I know everyone would remember the DEC salt intervention that started.
We do.
Exactly. So that's where we would have started our first intervention using DEC salt back in 2004. Now, with recommendations from World Health Organization and, with the advancement of medicine, we would have moved away from that, and we would have stepped up our efforts by now using a double drug therapy with DEC aspersins with nootobanocyte and albendazole. So we used a double drug therapy, and this targeted, of the 9 regions, it targeted 4 of them. And these regions that were targeted was your highly endemic regions of the others. So those regions were regions 3, 4, 5, and 10. So you had MDA interventions being done in those regions. Of course, we were getting there, but it was a really slow approach because we were using a double drug therapy, and we needed to have 5 successful years of using that. So that started in 2014, as I mentioned. So in 2018, yes, with recommendations from WHO again and the advancement of medicine, we were able to include or incorporate a 3rd drug, the ivermectin. Hence, we had a triple drug therapy now. And thankfully, with that, we only needed 2 successful years. And I must say, we would have achieved those successes in 2019 and 2021. So there you had it. We were now at the point whereby we can stop doing MDA. And also, prior to implementing using the triple drug therapy, we had to now achieve 100% geographical coverage, meaning for the regions I had no interventions done that I knew were endemic, I now had to do what was called a remapping to see where the prevalence of the disease, what is the prevalence of the disease now in these regions. So instead of now doing 4 regions, I was doing the 8 regions that needed MDA. So we would have covered all our bases all of the area that needed that intervention. And like I said, we were successful in 2019 and 2021 with our MDA. So now we reached that point whereby we can now stop MDA, and we went into our survey mode. Now, the surveys that we were doing was to test to see what was the impact of using IDA in these areas that were prevalent or had cases of filaria. Now, in order for me to say that an area is endemic, that area or has active transmission of filaria, that area had to be more than 1% prevalence rate. More than, when I do my investigations, more than 1% of my population must be affected in order for them to be deemed endemic. So that means if it's less than that 1%, then it's a non-endemic area. So in our surveys that we would have done, remember I told you before, 8 regions we were doing MDA in.
Yes.
So after that survey that we would have done in 2023, I am happy to say that of the 8, we now brought it down to 2 regions.
Wow.
Yes, 2 regions that actually needs MDA intervention. So Guyana has been made in significant strides.
Significant strides indeed.
It's really excellent to see where we would have come from, where we are, and where we still have to go in eliminating filaria as a public health issue.
Definitely. And I must say congratulations and great job to you and your team for the awesome job that you guys have been doing with this campaign. Could you tell us what was the response like from persons, even as you guys go house to house, region to region? What was the response like from the public?
Thank you for the question, and thank you indeed. As you mentioned, it's a team effort and not a one-person job. So I also want to thank my team for the great job that they do. And we have teams in all regions. The response, it differed based on where you actually went. You had persons who were, really interested and willingly, participating because they understood how important it is to protect themselves, and not only themselves, but their family and those around them, their community. So for the most part, you had really good feedback from the population. But of course, you'll have those 1 and 2 areas whereby persons, they definitely don't want to be a part. They don't see it as important. And those are the areas that we're now seeing we're having difficulty, and hence the reason for us having to redo 2 rounds of MDA in those 2 regions.
Thank you, Dr. Sampson. We're going to go into a short break and be right back. The mosquitoes responsible for spreading dengue are most active during daylight hours and can breed in small amounts of still water. Here are some simple tips to safeguard yourself and your community from dengue. At home, school, or work. Cover water collection points with a fine mesh or lid and regularly clean areas that can collect water easily, like plant pots, flower vases, discarded plastic containers, and pet water bowls. Ensure that your gutters and drainage areas are clear. Keep doors and windows closed or install insect screens to prevent mosquitoes from entering. Use mosquito nets, repellents, and vaporizers to keep mosquitoes away. And wear long-sleeved shirts and pants to protect your skin. Don't wait, act now. Together we can keep our surroundings clean and beat dengue. A message from the Ministry of Health. Welcome back. So, Dr. Sampson, we want to talk a little bit about filaria and leishmaniasis, the causes and the symptoms for those persons who are watching and still are not too sure what it's about. And, we want to raise awareness on these 2 diseases. So tell us about filaria. What are some of the causes of it?
So definitely, I'm glad you asked that questions, because from going around, you would hear when we do different surveys and so on, there are a lot of misconceptions and
yes,
when it comes to these neglected infectious diseases. For example, filaria. People think that you can get filaria if a frog blew on your leg, and they think all sorts of things with respect to what causes it. However, filaria is a vector-borne disease, and when I say vector, what do I mean? So it's a disease that's caused by the bite of an infected mosquito, Culex mosquito to be specific. So it is a vector that causes it, and not what we think, it's a frog blew on my egg, I stood on the concrete and it was too cold. No, it's a vector-borne disease. As I mentioned, caused by the bite of an infected Culex mosquito. So we know mosquito, they take a blood meal from us, and as they're taking their blood meal, they're depositing filaria worms into our bloodstream. So that is their number 1 cause for filaria. That's how you actually, the parasite is being passed from vector to human through the bite of an infected mosquito. So the thing with filaria is there is a long, what we call incubation period, because you can be infected today and you will not see symptoms or signs until the next decade of your life, next 10 to 15 years of your life. Then is when you're actually seeing the clinical manifestations of filaria. And what are those? They have 3 forms of clinical presentation. You have your asymptomatic, and as the name suggests, asymptomatic, there's nothing indicating to you that you might be infected. No sign or symptoms whatsoever. However, if you do a blood test, there you have it, the filaria parasite in your bloodstream. But you also have the chronic manifestation. Here it is now, you actually seeing the clinical manifestations such as, swelling to the arms, leg, breast, and scrotum. And of those swelling, the ones to the lower extremity or your legs are the most common ones we see in our clinic setting. Mind you, we do have swelling persons or patients with swelling to all those parts that I mentioned, but the most common one you'll find is swelling to the lower extremity. Now, with respect to the swelling to the lower extremity, you'll find that if both of your lower extremity or your legs are swollen, what is characteristic of filaria is that it's asymmetrical when bilateral. What does that mean? You have both lower extremities swollen, but your right leg can be more swollen than your left, and vice versa. There's some specific characteristics also with respect to the swelling. In some cases, when it's in its early stage, you have what we call reversible swelling, meaning that patients would even tell you themselves, doc, in the day, this leg is so swollen, but when I go to bed at night and I wake up in the morning, it's as though I have a normal leg again. So that typically what patients would come and tell you. Of course, those who are in their early stages of lymphedema or swelling to the extremity, lower extremity. You also have the case whereby it reaches a stage where it's no longer reversible and you have your permanent swelling steps in now. For those persons with permanent swelling, they usually have skin fold, whether it's deep or shallow. They have knobs on their leg, coming out on the extremity. In some cases, they have mossy lesions. And because of circulation difficulty, they're prone to having cut, scrapes, and deep bruises that eventually, if not treated in a timely manner, can cause ulcers, chronic ulcers to the lower extremity.
So I know of persons who may have a swollen foot, and they might say, okay, I've been on this foot too often, so maybe I just need to elevate it and rest it. Is that the case for most, or should they just visit their health center or even the doctor to find out what is going on? Because persons would usually do self-diagnose, right? So definitely I think they should visit the health centers, but when should they raise an alarm?
So everything that I just mentioned to you should be alarming if you're experiencing it. So those are some of the alarm signs, and there's one I forgot to mention. It's the acute attack. So this one, persons, whether they have the chronic swelling or not, what they would express or identify or complain that happens is that they will all of a sudden have a pain to the left or right inguinal region, and then they notice the leg is, swelling more than it should, or it now starts swelling. There is redness, there is pain, and they're unable to walk. So those are the different things you can look out for, or if you suspect someone has lymphatic filariae. For those persons, we advise you not to self-diagnose, but definitely reach out to your nearest health center or some medical facility where you can get the correct diagnosis, because swelling to the lower extremities, they have multiple causes outside of lymphatic filariae being a cause. So definitely you want to go to your nearest health center, hospital, where you can the doctor can do a differential diagnosis and steer you in the correct direction. So your preventative measures for filariae, you have your pharmacological preventative measures and your non-pharmacological preventative measures. Now, in the case that you just brought up, this will need your pharmacological intervention, because if you're in the early stages, the most common way of preventing it is by taking your filariae pills during the month. This is actually recommended by the World Health Organization as a preventative measure to take your filariae pills whenever there is filariae distribution within your area. So that is one of the ways.
So for persons who haven't had the opportunity yet to take their pills and they're thinking about doing it now, where can they go?
So definitely we are currently planning Mass Drug Administration campaign, that is your filariae pill distribution campaign, in 2 regions come the second quarter this year. Hopefully we are planning those interventions. So definitely we will be back having sessions like this, orienting the public as to where they can access their filariae pills. And when we do have MDA campaigns, our pill distributors, they walk about, they go door to door, they have fixed points, they even visit the school. So when that campaign starts, you definitely won't be able to miss us. We will be everywhere.
Those purple t-shirts and hats, definitely.
Our uniform too.
So we want to talk a little bit about leishmaniasis, and I know many persons are not so familiar with this. What are the risk factors for developing this disease?
So what we identified, persons who travel to endemic regions. When I say endemic regions, I mean you have for leishmaniasis regions such as regions 7, 8, 9, 10, and even some parts of region 2 are known endemic regions where we actually have patients. So if you're a minor, because we have a lot of patients who are minors because they visit these areas for work and so on, they are actually considered risk factors for or at risk for developing leishmaniasis. We have our soldiers also, another group of vulnerable persons who because of the terrain they actually, work and go to, they are also at risk. So you have your miners, loggers, soldiers. Those are persons who are at risk, and of course, who don't necessarily take the preventative measures that they need to in order to prevent them from being bitten.
So the symptoms for leishmaniasis is different from filaria, or it's kind of the same?
Oh, it's different, and of course the vector, even the vector that causes leishmaniasis is different. You wouldn't believe that leishmaniasis is caused by a vector. It's also a vector-borne disease caused by the sandfly. Would you believe that? Yes. The sandfly is what causes leishmaniasis, or as persons would refer to it as bush yaws. So what happens, sandfly usually bite at dawn mostly, dusk or dawn. So, and they usually target the exposed areas of your body, your neck, your legs, your hand. So we would find patients coming to us saying, Doc, I was in region 7, for example. Of course, they don't mention the region, but an area I was in, Camarang, for example. And, I felt as though something bit me, but I wasn't sure. But let's say like 2 weeks after, I noticed there's a small bump on my hand. And I decided to, many of them do this. They don't allow the natural process to happen, so they actually dig it with a pin, they scrape it with something because they're curious as to what is this bump and why it's there. So what they do is they open it, and of course, after a period of time, it becomes infected, but the natural course of it is to start like that, and then it actually ulcerates.
Wow.
Meaning it eats away at the skin or the location where the person was bitten. So this also is characteristic, because you have other diseases that would cause ulcer, but the ulcer in the case of leishmaniasis is characteristic. It has the edges of it is usually elevated, and it has a depressed center. So we give it the name volcanic crater-like aspect. You know how the volcano usually is. So it develops characteristics like that, where the edges are elevated, the center are depressed, and in some cases, once it's a typical lesion, you find that they have what we call satellite lesions. Those are smaller lesions around the main lesion. So those are some of the signs or symptoms, the signs persons can look forward to. Another important thing about this specific ulcer is that it's painless, unless if infected. So yeah, it differs from filaria.
Thank you, Dr. Sampson. We're going to go into another break and be right back.
Dengue symptoms can range from mild to severe. Mild symptoms include fever, headaches, eye pains, muscle pains, joint pains, nausea, vomits, generalized weakness, and severe fatigue. Within a few days, a rash can appear. Severe symptoms include persistent vomiting and bleeding from any site. These sites can include the nose, a heavy menstrual cycle, and even blood in the urine or stool. If you are experiencing any of these symptoms, please seek medical attention urgently.
Dr. Sampson, thanks again for joining me on the program. But before we wrap up today, could you tell us what activity that you guys have planned for the Neglected Tropical Disease Day, which is on January 30th?
Definitely, Ms. Martin. So we are collaborating with our sister program, which is the Leprosy Control Program. And we will be having a mini exhibition in the GPHC compound, Middle Street entrance. This is just outside of the outpatient department. So we plan to bring awareness concerning neglected tropical disease. We'll have IEC materials on display. Persons can come and interact with our specialists and, have their questions answered concerning neglected tropical disease. If they have any of the signs and symptoms I would have mentioned earlier, they can come have it checked out, speak to the experts, concerning these. And of course, we also want them to see what we see if we test their blood and they're positive, what that parasite look like. So they can have the opportunity to come take a look under the microscope, see what these parasites or worms that we're talking about actually look like. So there's lots in store. Just, come out.
What can we expect from you guys in the months ahead? I know this is the beginning of 2024, and I know that you guys have a lot planned. So tell us some of those plans that you guys have.
Definitely. So one of the major plans on our agenda, especially for the first half of this year, is our MD or fileria pill distribution campaign. We have that slated for the second quarter of this year, and we're currently in the planning phase of that activity. We're actually recruiting personnel to fill the different position of, regional coordinator, national supervisors, field officers, field distributors. So we're actually planning towards implementation of MD 2024.
Thank you so much for joining me today on the program, Dr. Sampson. And I want to encourage you and your department to keep up the good work that you guys have been doing. Thank you for joining me on the program today. I'm Alicia Martin saying goodbye for now.